We are going to perform paracentesis. It is a procedure performed to obtain small sample of or drain ascitic fluid for diagnostic or therapeutic purpose. So it is done to identify etiology of new onset ascites, to rule out spontaneous bacterial peritonitis with concerning symptoms, and for draining large volume of therapeutic fluid.
Today we are going to perform paracentesis using Seltinger's technique. Before doing this procedure, the steps of the procedure, the risk and complications that can occur should be explained to the patient, and we should get his or her consent. So the instruments and materials needed for this procedure are trocar with needle, 5% lidocaine solution in anesthetic syringe, needle holder, cotton ball dipped in alcohol solution, scalpel, and gauze pads. Before the procedure, all aseptic and antiseptic measures should be carried out, including wearing sterile gloves and face mask. All the instruments must be sterile. The patient should void before the surgery, and the position of the patient is supine. As you can see, this is the abdomen and this is the umbilicus. The point of puncture for paracentesis is 2 cm below the umbilicus, and before administering the anesthetic solution, we should take the cotton ball dipped with alcohol, and with a circular motion from center to the point of puncture to the periphery, we should rub the alcohol. Never bring the cotton ball back to the center. And take another cotton ball dipped in alcohol, and the same circular motion, do it again. With a cotton ball marked with iodine, mark the area of puncture, put an X. Then take the syringe with 5% lidocaine solution, enter it subcutaneously, and administer the solution in all angles. Advance intramuscularly and administer the solution. Remove the needle and wait for 90 seconds for the anesthetic to work or take action. After the anesthesia kicks in, take the scalpel and hold it in the pinned position and cut above the area of the puncture with a small incision on the skin and subcutaneous layer to facilitate the passage of trocar. The appearance of the blood or hemorrhage is controlled with, bleeding is controlled with gauze pad. After that, the needle holder with the needle is taken for the suturing and the placing of the catheter that we are going to put later. In this direction, we are going to put the suture to hold the catheter in place. After application of the ligature, we must then take the trocar. Trocar has 3 parts: base, the shaft, and the apex. The base of the trocar lies in the palm of your hand, and 3 fingers to fix it, and apex and index finger lies on the shaft. With a rotating circular motion, the trocar is administered into the abdominal cavity through the incision, and stop when you feel no resistance, because further administration can cause damage to internal organs. After administration of the trocar, remove the needle from the trocar and close the aperture with your finger. After closing the aperture, take the drainage tube and insert it through the aperture of the trocar into the abdominal cavity. While doing this, you can see a flush of peritoneal fluid that will come rushing through the drainage tube. Apply a clamp onto the distal end of the tube and carefully remove the trocar leaving the drainage tube inside. When you see this portion, we can remove the clamping from the distal end and move it to the proximal end. Remove the trocar carefully. And attach this to the drainage system. In this case, the drainage system is a vacuum bottle, and keep it below the body cavity or on the below surface to the patient's body for the collection of the fluid from the peritoneal cavity.
So the complication of this procedure include damage to urinary bladder, abdominal wall hematoma, infection, perforation of the bowel, formation of ascitic fistula, dilutional hyponatremia.